My name is Fortune Kwashiga, and I'm doing the case study review narrative on Helen versus Carey. Facts of the case. In this case, the plaintiff Helen, a 32-year-old female, sued her ophthalmologist, the defendant Carey, for malpractice in which she claimed to suffer permanent visual damage due to open-angle glaucoma as a result of the defendant's failure to diagnose and treat the condition. The defendant and medical expert witnesses established that the standard of the profession does not require routine pressure tests for glaucoma upon patients under the age of 40. The reason is that the disease really occurs and is seen in 1 in 25,000 patients. Testimony indicated, however, that the standards of the profession do require pressure tests if the patient's complaints and symptoms reveal to the physician that glaucoma should be suspected. The issue was whether the ophthalmologist's compliance with the standard of the profession of ophthalmology, which does not require the giving of routine pressure tests to patients under 40 years of age, should be protected from liability considering the facts of the case. The outcome of the case. Both the trial and Court of Appeals ruled in favor of the ophthalmologist. However, the Supreme Court decided that the judgment of the trial court and the Court of Appeals decision be reversed. The Supreme Court held that under the facts of the case, reasonable prudence required the timely administration of the pressure test to the patient. In failing to administer the glaucoma test, which is a simple pressure test that is relatively inexpensive and harmless, where the disease can be halted to avoid the grave and devastating results, the ophthalmologists were negligent, which proximately resulted in the damage sustained by the patient for which the ophthalmologists were liable. The legal practice involved in this case. The court reversed judgment for the ophthalmologist in favor of the plaintiff because reasonable prudence required them to timely administer a routine pressure test for glaucoma, even though the professional standards did not require them to do so. The court essentially ruled that even though the customary practice at the time was followed, the physician was still liable, citing the duty of the court to say what is required to protect patients under 40 from the damaging result of glaucoma when the standards fail to afford the one person out of 25,000 the same protection. Application to today. The ruling in this case prompted state legislators to pass laws that define the standard of care in their jurisdiction. The state of Washington was the first to pass this type of legislation, stating that the standard of care is not met when the defendant fails to exercise that degree of skill, care, and learning possessed by other persons in the same profession. It is very important to note that it is up to the courts, as well as the medical profession, to decide what is reasonable and unreasonable. As professionals, especially in the healthcare field, I believe a greater duty of care should be imposed on oneself than is established by the profession. The duty could be imposed when a disease such as glaucoma can be detected by a simple, well-known, harmless test where results are certain and the disease can be successfully arrested through early detection. I concur with the judgment in favor of the plaintiff because in reality, choosing between an innocent plaintiff and a doctor who acted reasonably according to his specialty, but who could have prevented the full effects of this disease by administering a simple, harmless test and treatment, the plaintiff should not have to bear the risk of loss. Today, this case has changed the practice of offering the pressure test to all patients with subsequent increase in cost and no change in mobility.
Was that it?
This is one of two cases that legally establish that while great weight is given to customary practices with regards to the standard of care, custom is not the ultimate factor in determining negligence. In essence, it suggests that what is commonly done may not be enough, and that there are some things that may not be standard but are still reasonable for the physician to perform. Thank you. Testimony indicated, however, that the standards of the profession do require pressure tests for the patients. Stop.